Hi, I'm Dr. Allan Perel. This is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and tri-state community. Tonight's topic is really very close to my heart and really a favorite of mine. And I have a guest here who was wonderful a few years ago when we spoke. This is Dr. Mayank Parikh, and it's a pleasure to see you, Mayank. And he's a pharmacist. And you think about pharmacy, you think about the store you go to and where we go, but there's a lot more to it. And I really want our wonderful audience to really understand what a pharmacist does. We have a healthcare professional team. I mean, I've got nurses and nurse practitioners, there's physician's assistants, there's doctors. And the pharmacists, sometimes we don't think about them. And I'll even go a little bit further. I work in the hospital. I'm chief of neurology at one of the major hospitals in New York. And the pharmacy team comes with us on rounds. And they really teach us a lot of interactions and things like that. So tell me first about being a pharmacist, and tell me what training or education someone needs to become a pharmacist.
Yeah. Well, Dr. Perel, thank you so much for having me again. Really do enjoy your company and being here. And my late father, he was a physician. He was from your trade. He was a primary care physician and a nephrologist. So he was always a big inspiration of mine. And, growing up, I knew I always wanted to do something in science. And, then when I was a senior in high school, my dad was busy, with his patients and raising us with my mom. He said, what do you want to do? I said, I want to do something in medicine. I want to help people. He said, why don't you think about pharmacy? He had a couple of pals that were pharmacists. I said, I never thought about being a pharmacist, but, what is it about? So I kind of shadowed a friend of his that owned an independent community pharmacy. And he's like, all right, why don't you do it? I said, all right, I'll do it. Let's go. And it's a 6-year program, a direct program from high school. So as long as you keep up with the grades, you're guaranteed admission into the pharmacy portion. So it's 2 years of sort of undergrad, they call it, and 4 years of professional practice. The last year in that 4-year period, so your year 6, it's all clinical rotation. So you're in hospitals, pharmacies, doctor's offices, pharma companies, compounding pharmacies, you name it, whatever the curriculum is tailored towards your eventual goals once you graduate. So I graduated as a pharmacist a decade ago now, so celebrating 10 years.
Congratulations.
Thank you. And I started my career, I did about 4 years of service at the Philadelphia VA Medical Center, which was a phenomenal experience.
So what does a pharmacist do in the hospital?
So in the hospital, I was as a pharmacy student capacity, so I made all the IVs, I filled all the orders, ran them up and down, I got some really good exercise there, and the pharmacists typically are not patient-facing. They're either in the basement or somewhere in the building where it's just easily accessible by the whole hospital. So they're usually verifying orders, entering orders put in by the physicians, verifying the IVs that I was making. We did some compounding there as well.
What is compounding?
So compounding is making a medication that is not readily available, or it may be on a back order. Right now, there's a lot of medications on back order, but you would take the raw ingredients, like the fine powders, and you'd mix it up, kind of like a old school apothecary. But that now is coming back. A lot of medications are compounded and individually tailored for patients, which we're doing even in our own pharmacy. So
tell us, you brought a mortar and pestle. So if you're talking about compounding, show everybody.
So now, today, I'm with Super Health Pharmacy. I own and operate that pharmacy along with several others. And we're doing things that I never thought we'd be doing even 2 years ago, especially with coming out of the whole COVID era of healthcare, and it was terrible, but it allowed us pharmacists to really step up to the call of duty. So we're doing compounding. We are making medications that patients might be using for skin conditions. Patients might be using for some sort of acute infection if the antibiotic's not available. Recently we had some amoxicillins that was a back order shortage. Right now, there's a lot of back order on the weight loss medications. So that are things that are being compounded
So
as
how
well.
do you do? So I'm just curious. So you have a mortar and pestle here.
Yeah.
So you put the ingredients in, and what do you do?
So it looks a lot easier here as it is, but it is very complex. We have a state-of-the-art compounding facility in Clifton, New Jersey, which we have. It's like a clean room. So you have the raw ingredients. We have a lot of machinery too that assists us to kind of streamline things. Whether if it's a capsule, we'll make the powder. There's a machine that helps us turn it. This mortar pestle is more maybe for just aesthetics, but there are some things we do actually make out of this very own mortar and pestle if it's a simple wart compound or something like that. But the more complex, more tailored prescriptions that we do are made in our lab just to make sure all the stability is.
So it's almost like where someone like the pharmaceutical company makes it at certain places, you sort of emulate that.
Yeah, on a smaller scale,
right.
but yeah,
Of course.
we do that, and the individualized personal care is coming back. As you know, patients are tired of not being able to go anywhere after COVID. They want the touch, they want the feel, they want to be face to face. I know whenever I come see you, you're always, it's very patient facing. My dad was the same way. Whereas sometimes you may go to even a pharmacist or a doctor and, they may be just kind of glued to the computer, which is, that's not the way maybe is ideal for the patient, even though it's not, it's just circumstantial, So this is allowing us to make tailored medication for patients and really understanding them and what their needs are and what their wellness goals are.
So, and again, yes, I'm old school with having patients there and in the office, and we like to look at patients, and there's a lot more to it. There's seeing the patient, there's actually hearing, smelling. The idea of there's a cadence of how someone walks. You're just listening to them. So really there's a lot involved, and that can be done in a relatively quick time so people don't have to be exposed to infections. You've been so kind to my office and my medical staff by bringing the vaccines over, and I really want to say thank you to my whole family and my staff. You helped us get through a lot of time, and as a neurologist who runs a large infusion center and takes care of a lot of patients, the idea is we were never closed. And a lot of our patients who needed their infusions of medicines for diseases like MS, people who needed Botox for headaches, we'll say, all had to come into the office for it because you couldn't do those things virtually. And that's, thank goodness we're towards the end of that situation now. But again, there's a little bit of a recurrence, or resurgence rather, of COVID-19. And we'll talk about vaccines in a few seconds. So tell us, interestingly enough, during the pandemic, even a little bit before, you would always go to your primary care physician and get your shots.
Right.
Now the pharmacy has become the pivotal part of the place to get your inoculations, your vaccines. So tell us a little bit about vaccinations and really the availability and how interested you are in it, and really how you're giving back to the community with it.
Right. So interesting enough, pharmacists have always, and I love our doctors. My dad was a doctor. I have a very soft spot for our doctors. But they're busy, and their time is very valuable. Pharmacists' time is also valuable, but we're also very readily available. We're at any corner, you might find a pharmacy, whether it be a chain or an independent pharmacy such as the one I run. And, vaccines has really become such a routine part of our practice. Why is that? We're seeing these patients anywhere from 12 to 35 times a year on average. So what does that mean? We know where they're going, where their last vacation was. Are they traveling? Did they just have a baby in the house? Did they get their COVID vaccine or booster? Which, interesting enough, roughly three quarters of all the COVID-19 vaccines given in the country was given by pharmacists. So it really gave us a chance to answer the call of duty, step up to our full capabilities, because like myself and most pharmacists today, they're doctors of pharmacy. So they have very extensive training in not only dispensing of the medications, the pick, stick, and lick, just dispensing of the medications, this is a small part of what we do. But really the services and education, the vaccinations, the treatments now that the pharmacists are doing, we were also providing like the COVID-19 infusions at the height of the pandemic. So vaccines is, and it's all about trust too. Like if the patients are able to trust us and, we can give them, our job is always to educate the patient about what is available, not really say, hey, the booster's out, you need to get it. Nobody wants to hear the word booster anymore. But if we can show them, and we are also learning this information as it's coming from, the updates by the CDC or the manufacturers. So once we make sense of it and once we have the good data behind it, like, hey, listen, this is what's available, you're due for it, this may be a good option for you, and most of our patients are long-time patients now. They've gained trust in us and confidence in us. And we also empower them too, that, hey, do your own research as well. Speak to your doctor, family members, people you really trust, and let's see if this is a good fit.
So we're coming up to the fall,
Yep.
and people are going back to school, and a lot of people are doing some work from home, but a lot of people are becoming much more interactive. And we used to say in my house that we'd always get an illness within the first 2 or 3 weeks of school because there was always one kid who was sick. The entire classroom got sick, and then they'd bring it home, and we'd name it after that child. But what are the recommendations now for vaccines? And again, just we even go over the flu shot, when is that coming out?
Yeah, so the flu shot's going to be available any week now. Patients can expect it at our pharmacy within the next few weeks. Ideal time to get it is early fall, September, October. We really don't want to wait past like Halloween, I would say, just because that's when you may already catch something at that point. So vaccines are to prevent the illness.
And it takes about 4 to 6 weeks to get full immunity.
Right, yeah, exactly. So, I would say, patients, it's still summer, people are in summer mode, but let's start thinking about it. We're empowering our patients to say, hey, listen, this is what you're going to be due for. And we're using technology really to our advantage as well now. We're seeing the patient's age, our systems are linked with their central registry for the state, so it sees which vaccines they've ever gotten in the past, so we can say, hey, listen, if you're over 65, you're due for your pneumonia shot, you're due for your shingles shot, you're due for your flu shot, you may be eligible for the RSV vaccine as well.
So RSV is respiratory syncytial virus. It was a big pandemic, or not even pandemic, that's not a good word. There was a big uptick in it a few months ago. And a lot of people got very sick with RSV. And after COVID sort of died down a little bit, that was actually in our hospital one of the most common infections where people had severe respiratory problems. Wow. So they're recommending now patients to get RSV vaccines who are how old?
60 and older. Mm-hmm. So if you're 60 and older, it is recommended. Mm-hmm. And we are going to be carrying the vaccine very soon. We have a lot of interest. Mm-hmm. Patients are asking us about it. We are training our staff on it too. As you know, it's a new vaccine. But it is recommended, it is approved, it is safe from what the initial studies are showing. And, but we are going to have, they're saying there may be some triple threat, hopefully not, but between flu, COVID, and RSV, we want to make sure at least the most vulnerable population is protected. We want to make sure all our patients have gotten the flu shot as well. And along with COVID too. COVID, like you said, COVID-19 is on an uptick with the new variant. So, our advice is to our patients and even our team members, hey, listen, if you're coughing, you don't feel well, stay home or wear a mask. And same thing with our patients. If they're not unwell, then maybe limit some social gatherings.
So it sounds like you went into the community instead of being at the hospital and different kinds of pharmacy, is because you wanted to be around people. Mm-hmm. It sounds like a lot of things, and so do I. So that's why I do what I do in the community. So the idea is that you're really an integral part of the healthcare system and the healthcare of any individual patient. So let's talk about some of the issues. So we talked about vaccines, and maybe I'll even just go back a step. For the people out there who are afraid of vaccines, and there are a lot of them, as a physician, I tell people it's crucial that you take your vaccines. Getting sick is very bad. I had a lovely woman who came in to me today who had shingles. And she had terrible pain from the shingles. And it's been about a month, and nothing we gave her was helping, and it was really, she was desperate. And I asked her just out of curiosity if she took the shingles vaccine, because sometimes the vaccine, it doesn't always work. She said, no, I made such a terrible mistake in not doing it. As a whole, people might say, yes, not everybody gets it, but it's still important. And again, as a physician, I think we're just such in a lucky period of time that these vaccines are available. I'm not going to go through all the politics of them, but the idea of in my own opinion, COVID-19 has been controlled because of the vaccine.
Right.
I've seen so many people very sick in the hospital through the pandemic with COVID. The flu, I've seen people die of the flu. RSV, we've seen some very sick people. So the idea that we could prevent illnesses, I think, is so crucial. Tell me about your idea. What are your thoughts? I mean, after I've said such a strong opinion about vaccines, what are your thoughts of vaccines?
I think it's extremely important for pharmacists like myself and physicians. We let them know that, hey, this is what the recommendation is. This is what the science is showing. This is what the statistics are showing. It's not something that, hey, Mayank feels this is good for you. We have to go by what is out there. We have to trust what is out there. I'm very confident that vaccinations work. As you just brilliantly said, we've been able to get COVID-19 under control is because of vaccines. Of course, there's politics behind that on this and that, but just let's look at the facts, right? Hundreds of millions of people have been vaccinated. People are protected. COVID-19 numbers are down significantly than 2 years ago. But that's thanks to breakthroughs through science and research and vaccinations, So if there's something out there that could be deadly like the flu and you can simply prevent that by getting a flu shot, absolutely. We need to do that.
We're going to jump around a little bit. Tell me about generics.
Sure.
So many people are concerned that the medicine they might have been on for the last 10 years, maybe it's a cholesterol medicine like Lipitor, and now they get a medicine, they see the same bottle, they see a bottle, maybe the pill looks a little bit different, and we put 5 syllables and say atorvastatin, some long name, and they say, is this the same stuff? Should I be confident about generics? And again, with cost issues, what do you feel as a pharmacist when someone comes to you and says, is this the same thing?
Yeah. So, absolutely. I mean, right now, we need to be very cost conscious, even as business owners, even as patients as well, and ourselves as consumers. So generics are absolutely safe. They're fine to take. Even the products we carry, they're in U.S., they're U.S. FDA approved, meaning that, it's not something that's not safe or not been tested, especially on the prescription side. So if you can, the brand may cost thousands of dollars, but if you can get a generic, which most independents, they have, there's a very common misconception that, hey, I need to go on GoodRx, or I need to use my insurance to get the cheapest price. I guarantee you, any independent that any of our viewers or patients walk into, they're going to get a great price on their generic medications if, they have any problem affording their medications. And that's just what we do. I mean, we're here to help our patients, and like myself, there's thousands of pharmacists out there, independent community practitioners. Of course, in the chains, it's a little restricted. It's corporate. They have not as much flexibility in that because the prices are preset. But I empower our viewers. Go into an independent, ask them, hey, I have 90 days supply of Torstatin. What's the best price you can give me?
So shopping around is appropriate. Sometimes people don't think that going from one pharmacy to the next and asking a question is even appropriate.
Yeah. So I wouldn't necessarily say shop around between independents. This is more or less, hey, if you're a lot of patients, they have insurance. They think they have to use it, go through the mail order. And that's what this is more what I'm referring to. They have to wait till like 2 weeks, get it there. And the copays might be similar. You can get it from the independent pharmacy.
So talking to the independent pharmacy will help them get the best that they can, whether it's 90 days, 30 days, whatever it is.
Whatever it is.
They get the best price.
They're going to get their best price. I guarantee it. Because we're, at the end of the day, our success is the patient's success. Patient success is our success.
So I know you well, and you've taken care of my family, my friends, my patients. Tell me a little bit about your durable goods. So when you think about pharmacies, you think about medicines, you think about being in the front and all the things that you sell. But what are durable goods, and what should people know about them?
Sure. So we just launched a fully accredited, which is now certified by Medicare too, durable medical equipment, or DME, or durable medical supplies. We are able to now, at our SuperHealth Pharmacy location, able to get patients wheelchairs, walkers, rollators, scooters, braces, standing walkers, you name it, canes, commodes, we can get anything that the patient may require with our accreditation now, and possibly be able to process their insurance as well. Or, if there's any issues with insurance, they can get a competitive cash price as well. And why is that important now? Right now, there's not that many options. Whether it be diabetic shoes or crutches, a lot of the older medical supply stores, you see it, they just vanished, There's a big push with the e-commerce. So that's why we saw a need in the community. Especially people want to see things, they want to try them on. They want to be, like a wrist brace, you want to put it on, you want to see how it feels, as opposed to just ordering online. And you may want to go through your insurance as well. So that's why we wanted to make this investment.
And also sizing. I deal with a lot of patients who we use these what's called cock-up splints for carpal tunnel. So not everybody is a perfect size, small, medium, large, or one size fits all. So then putting it on really does help a lot with it. Tell me, if someone's not walking well and they want a cane, do they just walk in and say, I'd like a cane, or do they bring a prescription? How does it work for, say someone has somebody who wants a walker or a wheelchair. Is it their physician or healthcare provider has to give them a prescription for it or say you need it? Or could you decide on your own, I'm really just not walking that well, should I try a cane?
Both. You can come in and if you need a cane, say, hey, I see you selling canes, can I get one? Absolutely, we can give it to you, no prescription required. Or the doctor might recommend it, and the doctor might give them a prescription. And in that event, we will process their insurance and try to get it for them covered for no cost, if it's no cost.
Are a lot of people surprised that their insurance companies will pay for certain things? And what kind of things do insurance companies pay for that people might need?
Here's the funny thing. It's split because some people believe their insurance should pay for everything, but the insurance companies don't have that same
of course,
perception, for better or worse. But patients are happy when they're covered, definitely. When they're not covered, we understand that, and we wanted to do a program that really takes that into consideration and makes it affordable for patients. Nobody wants to buy a brace,
Right.
And so, we want to be there when the patients need us.
Tell me a little bit about cutting-edge things in pharmacy. We spoke a few years ago here, and your reputation has gotten better and better. Not that it wasn't good to start, and the number of places that you're working at, and really your personal service and your care has been remarkable. Tell me a little bit about some new things in pharmacy. You sort of teaching me a little bit that I didn't realize you guys have a place in Clifton, New Jersey that makes pills or tablets, and I'm surprised because I think it only comes from industry. I didn't realize that small companies can make it. Is there anything that's happening in pharmacy that would shock me as a healthcare provider or our viewing public and say, wow, I didn't realize they did that?
Yeah, absolutely. So two things I'll talk about. One is that we've been working very long and hard on this. So as you know, with COVID-19, this kind of fell to the wayside, unfortunately. And it is the opioid epidemic. Suicide rates are through the roof. Opioid overdoses are through the roof right now. And as pharmacists, we're licensed and able to prescribe and dispense Narcan through the New York State.
And tell me what Narcan is an antidote to opioids.
Yep, it's an opioid antagonist. So God forbid someone has an overdose, you would give them this nasal spray or injection, and you would reverse that overdose, and then you can get them immediate care. It's life-saving. It's similar like an EpiPen. So, New York State, they mandate our pharmacies to put a controlled substance sticker on the bottle, and what we went ahead and did was we work with I'm part of this coalition tackling youth substance abuse. So in collaboration with TISA and the Borough President's Office, I have a dear and friend there, Dr. Ginny. We wanted to think of ways how we can get, and this QR code takes you to a link with unlimited resources that TISA has put together. 24/7 talk and text to somebody if you need him. Where to get Narcan training, where to dispose of unwanted medications, which you can take back to the pharmacy, and where to get additional resources about mental health, help, or whatever it is. And now we live in an age of now. People want everything right now, right? So we're like, how can we leverage this to get the patients the information they need right away? So we decided, and we decided to put it on the auxiliary label. So now, every single bottle that has a controlled substance, you have this auxiliary label with the QR code. So you can scan it and it'll give you resources 24/7. So we put this out and it's been perceived really, really well. It was actually featured as the cover story for America's Pharmacist. And this is something that I believe is going to bring a lot of value to the patients because they need to know what they're taking. They need to know what the potential harm is. And they need to know where to go for resources if they need it. So that's one of the projects we're working on. And you can go on our website and you can see kind of all about it, or visit TYSA's website.
What's it called? So spell TYSA?
TYSA is Tackling Youth Substance Abuse. It's TYSA. And they are doing cutting edge things in the industry that's really putting a strong focus on our youth and making sure that they don't end up kind of down the wrong path.
That's super. And back to one thing you mentioned, Narcan. Is that now available without a prescription?
It's going to be soon, over the counter.
Yes.
They are working on that.
And that's important for almost everyone to have in their homes.
Yeah, 100%. And
So go ahead, please, because we only have a few seconds left.
One of the other things we're working on is what we call drug-induced nutrient depletion. So a lot of the patients may not know that, hey, I'm taking metformin, I'm taking a blood pressure medicine, lisinopril, but there is something that happens which is called drug-induced nutrient depletion, which something that may be helping your blood sugars like metformin may be depleting essential nutrients in your body, such as if you're taking metformin, maybe B12 and folic acid is being depleted. So a patient may not know, your sugars are improving, but hey, doc, I'm feeling tired, my legs are cramping, I don't know what's going on, I'm going to sleep early, I'm drinking my coffee, but it could be because there's some depletion in some vital nutrients in your body. So that's another program that we're working on.
That's marvelous. I'm going to say goodbye, and I know you want to give a shout out to your kids.
Yes. Thank you to my beautiful wife for watching the kids so I can be out here and hang out with you today.
Thank you.
And, my family, my wife Ashri, my son Aryan, and my younger son Arman, my in-laws, and, my mom. She's always there for me. So
Thank you. You were a wonderful guest, and good night, everyone.